like yesterday. So appreciate you guys for joining. We are going to be talking about everything that is power couple. So how do we couple our most powerful procedures and products together? And this is your ABCs or Derm 101 and how we can best do combination, powerful, scientifically backed procedures and products together to get you the best skin that you possibly can. So let's go to the next slide. So today it's all about acne. So acne and acne scarring, this is the top concern that I see in both teenagers as well as adults. And I think it's so important that we do talk about this. And just to give you a little background, by the way, as far as how this relates to our 13-year anniversary, we are going to be giving away $13,000 in raffles and prizes, including things such as acne kits and laser treatments that relate to acne and acne scarring. You can save up to 53% off of everything that we're going to be talking about today. So just keep that in mind. And every day this week, we are targeting a special concern that is our top 5 that I see in the office. So today we're talking all about how to treat and prevent acne, as well as the scarring that comes with it, even if your skin of color, the hyperpigmentation, those divoted scars, and red scars that you see that take forever to go away. And I wanted to welcome Ruby as well, who is on, and she is going to be talking to us towards the end about how you can get the best benefits at Elite MD, which is called our Elite Club VIP program. So do keep that in mind. And just for joining us today, everybody does get a free gift, which will be emailed to you, which is our guide on just skincare in general. I know how confusing things can be out there, and I try to simplify it. I try to write it up my own way of exactly the steps that I tell my own patients. So you can enjoy that little read as well. And we'll go to the next slide. We'll kick it off with acne. So if you are a man or a woman, a teenager, skin of color, who gets acne, you are not alone. This is the top concern. About 90% of people will get acne at some period in their life. May look something similar to this. It may look a little different. It could be along any parts of the face, forehead, especially with hair care products, to along the chin line if you're getting more hormonal based acne. It could be on your chest. It could be on your back, also called backne, which is psychologically debilitating. It is a tough, stressful condition because unfortunately we can't cure it, but there are several things you can do to help control it and maintain it. Next slide. So we are going to be talking about just some of these causes, and some you have control over, yet some you may not. We know that genetics definitely plays a role with this, and clearly you don't have any control over your genetics. So certainly people who've had acne in your family, or if they've had severe acne, you could be more prone to developing acne. But there are things that you can do that are in fact controllable. And that could be, your diet. You have to look very closely at the things that you're doing in your own lifestyle that could be causing it. And there's recent data that shows that if you don't eat healthy, you are more likely to make your acne worse. We know that the foods that are healthy for you can actually help your skin, including acne breakouts. So that is a huge reason why some people can continue to break out over their lifetime. Another big reason is stress. So whether it's, you're a teenager at school, getting ready for your finals and school exams, to adults who, might be going through life events, life changes. Heck, we just went through COVID and still are going through COVID. And there's a lot of life shifts that have happened, whether it could be, having a family member get sick, going through COVID, losing a job, your health declining. All of those things are stressors for the body, or just a recent breakup. Something that's stressful can cause elevations in your hormone levels. And we clearly know that hormones are a major reason that we can break out. So especially for my women who are getting acne breakouts along the lower third of the face, your jawline area, the mouth area, Those individuals, you guys are like prone, you guys are my targets for hormonal acne. Unfortunately, I still did not break out. I mean, I have not shifted with my skin either. I still get my occasional breakout as well. And there are definitely things that you can do about that. Vitamin deficiency, here's another big one. So vitamin deficiency, there's been a link most recently that there could be decreases in vitamin D that is linked to acne. Now we're still finding out more information on it, but you know, the jury's out. So we know that people who are more prone to getting acne are more likely not going out and not getting the sun that they're supposed to also. So that could be one of the reasons why. We know that elevations in vitamin A can actually help treat it. We also know elevations in B12 can potentially cause more exacerbated acne. So we're still learning out more information there, but overall, we know that there's also inflammation going on under the skin, which is hugely important. And that's what we're going to talk about as far as treatment. So we're going to go to the next slide. And soon, I think we're going to have Crystal, our physician assistant, join us on our Zoom. So I'm going to introduce you to her shortly as well. And I think she may just be on her phone and logging in right now, and then we'll get her in soon. Okay. So let's take a look at what is going on underneath the skin. So if I were to take a little biopsy and took a look at your hair follicle, this is what's going on. So under the skin, there is a lot of oil being produced, and that could be related to hormones. That could be related to your diet. That is causing your oil glands to get clogged up. As a result, that breeds more bacteria, more inflammation, and that just causes this continual loop. So there are four main factors for causing acne: hormones, lots of oil production, clogging of the pores, and bacteria and inflammation. That's a lot going on under just one little pimple. So how do we address these concerns? The next slide is going to address that. Actually, there might be one more that just shows you may get whiteheads, blackheads, papules, or what we call what are bumps, basically those little red bumps or little bumps under the skin. Pustules, they're usually loaded with a lot of pus and inflammation and whiteheads. The cysts as well. Cysts under the skin are usually those very large, very painful pustules and cysts that you can get around the jawline area. So that all of those factors are going to lead to more scarring. So our number one most important thing is control your acne so we can control your scarring. Let's go to the next slide. Okay, so now we get into our Derm 101 program, which is how are we going to treat acne and treat acne scarring? So here at Elite MD, we like to take a 360 approach whenever we treat any specific hair concern. So in this case, when it comes to acne, number one, we call it the 4 Ps to pretty skin. So what are they? The first P, you want to prime your skin with the best, most important step, which is physician grade medical skincare. This is going to just prime your skin to allow everything to absorb and treat exactly where we want to. Remember those 4 factors that cause acne? We are trying to target each of those 4 steps. Number 2 is going to be peel. We're going to try to exfoliate the top layer of the skin. That allows us to actually penetrate deeper into the skin and actually get results where we want that. Procedure, that's the 3rd P. Now you come in and get your procedures, such as lasers, such as other injections. That's going to work much better because we have primed and we've peeled the top layer of your skin. And finally, the 4th P, we're going to protect. We want to prevent and maintain more acne and more acne scarring. Let's go to the next slide. Okay, so step 1, how do we get started? Let's get started with physician grade medical skincare. Let's go to the next slide. So with this, just as a diagram, so you know, we are going superficially. We're still going to the top layer of the skin. With each added step, we're going deeper. So you can imagine you're going to get much better results as we get deeper. So first step, we're going superficial. Next slide. And my easy Derm 101 step right here is, if you don't know where to get started, you've tried everything over the counter, and you just need something simple. This is your simple, scientifically proven 5-step regimen to get started at home. It will help both your acne and acne scarring. Now, I have a QR code, which will help you. If you have your phone nearby, you can scan this code and it should bring you directly to our site for the Acne Kit. So if you're like, where do I get started? Go ahead and scan this. It'll give you all the information I'm going to go through right now. And it'll help you to at least get your first P, which is priming your skin, done. So what are these steps? The 5 steps are going to be, number 1, I want you on the best cleanser possible that have active acne proven ingredients. So in this case, we have salicylic acid in it, which is the big one. Step 2 is one of my favorite steps, especially if you're a teenager, if you're working out and you're like, what do I do after I'm done working out? Well, these pads, keep in your locker, keep with you, and you can actually just swipe them. It's got glycolic and salicylic acid. It's going to help clean the skin, debride the skin, and allow for the other steps to work better. There is an acne spot treatment for those of you who are breaking out. I love just putting on the acne spot treatment in the area that I tend to break out, which is for me, the lower third of the face, and just use it for treatment, but also even more importantly, prevention. Because if I can prevent acne, I'm going to be able to prevent, I get the dark spots. So I can prevent dark spots, redness, and divoted scars. In addition, there is another step for one of the most important, people don't realize this, but if you are breaking out and you are getting hyperpigmented, you're getting brown spots, your acne scarring can be helped with our medical grade sunblock, which also has anti-scarring ingredients in it. So it's one of the most important things. People don't realize how important that is, but ours especially formulated to help both the scarring and the acne. Let's go to the next slide. So this is just a bigger picture of exactly what I talked about. Here's the other big step that I hear. My acne patients tend to be oily, or they tend to have combination skin. So do you need a moisturizer? My answer to everyone is always yes. You want to be on the right moisturizer, however. So a non-comedogenic, oil-free moisturizer that's going to do the job of rebalancing your skin. Because here's the problem. If you don't rebalance the skin, you will get more breakouts. And that's what we're trying to prevent. So it's a balance. So you're going to cleanse. You're going to use your surface pads to really help debride all of that oil. You are going to use a spot treatment to help with your acne spots, and you are going to moisturize your skin to rebalance that, as well as one of the most important things is our Scar Therapy SPF 45. Now, all of this is on the website, and it tells you what I love about it is it's going to give you the benefits, but the next slide will also tell you how to use everything. This is a frequently asked question I get asked all day long. Okay, great. Dr. Sonia, I've got all my stuff. What do I do now? So this breaks it down for you. Step 1, 2, 3, 4, and 5, and whether you're going to use it morning or night and at what order. So this is someone who's been using it. And I encourage you guys, patience is key with acne. You want to use this consistently every single day for a minimum of 6 weeks before you determine whether this is working for you or not. Ideally, I want you on it on a 12-week program. After 12 weeks, I can get your acne under control. Mild to moderate acne, this is a great place to get started as an entry. And if you get, everything under control, you're done. However, most people might need something a little bit more than just the topical skincare to go superficially. What it's also doing, it is going inside that pore where all that bacteria and inflammation live. And so we are helping to treat and prevent future acne, which is key in this. Let's go to the next slide. Okay, next P, really important, is exfoliating your skin. There's 2 ways to do that. You can do it through physical exfoliation or chemical exfoliation. Next slide. So this is where we're going deeper into the skin. We're going to the next layer. We just did the superficial. Now we're going deeper into the skin, helping all that dead skin layer peel away. So if you are removing some of that dead skin layer, you can imagine your next products, your procedures are going to go much deeper and actually get you more clearance. So we're going just a step deeper. Let's go to the next slide. And we're going to do the first step, which could be chemical exfoliation. With chemical exfoliation, what we're doing is you're going to be seeing one of our estheticians who were very experienced, very seasoned in treating all skin types, including skin of color, to help with combating acne, scarring, and hyperpigmentation. So if you are having active acne, or scarring, this is something you should do today, is to get an appointment with our estheticians to assess you, and they can just determine which tailored program to offer you. If you are one that loves to get facials done with chemical peels, this is the right one for you. It is customized, and the goal is to really help both the acne and the scarring. Next slide. Now, if you're like me, I love just having a spa treatment, and I love microdermabrasions and all of that fun stuff. This is the microdermabrasion of the future. It's called Hydrafacial Md. Whenever I'm in town, this is the first one that I do for my skin. What I love is that we're removing some of that dead skin layer. We're extracting all of those impurities in, like, all that clogged pore stuff, all that gunk that's just sitting there. We're cleansing, we're hydrating, we're moisturizing, we're infusing vitamins back into the skin. We are giving you what I like to call a red carpet glow. So a lot of our patients will come in before a big event, especially because they just get a glow from this treatment. It's soothing, it's refreshing, it's like a spa treatment. You see the immediate effects of it. And most important, we're going down under and cleaning out those pores, which is so necessary in acne. Let's go to the next slide. You can see this in action. Right here. I'm going to play a video for you. Okay, so it basically talks through the 4 steps with Hydrafacial. Let's go to the next slide. I love the next slide because it's a video production animation of what exactly we're doing. And we can play this video.
The Hydrafacial Md Hydropeel Tip's unique spiral design and powerful hermetic suction provides unparalleled non-invasive skin resurfacing and temporary pore opening to effectively cleanse, exfoliate, and extract impurities evenly without damaging the skin, while simultaneously delivering proprietary serums to the skin. The first step in the Hydrafacial Md treatment, vortex cleansing and hydropeel exfoliation, gently cleanses the skin and effectively exfoliates the stratum corneum layer, removing dead skin cells and sebum. This allows the skin to reflect more light and appear brighter and healthier. The second step uses a non-irritating, effective mix of both salicylic and glycolic acids to help loosen deep pore debris and dirt. This may prevent the formation of the pustules involved in acne. The third step uses painless vortex extraction, providing strong vacuum suction to automatically remove blackheads and other impurities. The fourth step in the Hydrafacial Md procedure applies vortex fusion, delivering a pro-antioxidant formula with potent peptides and hyaluronic acid into the skin. This step provides detoxification, rejuvenation, and restoration for healthy skin structure and function.
Sorry about that. So I love the video because it really is a great demonstration of what you can expect with Hydrafacial. Like I said, my kind of go-to treatment to kind of maintain my skin, prevent acne, help with scarring, and we can actually customize it for whatever you have. So I usually get a brightening treatment with it as well. And it just helps to, supercharge me to help with any acne that I might have. So it's my go-to for sure for anybody who's still breaking out with acne. Let's go to the next slide. Okay, and here's some before and after. So somebody who's got more mild to moderate acne, especially comedonal acne where you get whiteheads and blackheads, this is a perfect treatment for you. It'll just help clean all that up because you really can't go that deep with anything else besides really getting these extractions done. And the Hydrafacial Md can help you to do that. Let's go to the next slide. The nice side effect with this Hydrafacial is it also helps with some brown spots and it helps with some pores and some lines and wrinkles. So it's a great preventative and maintenance treatment program that I recommend everyone to be on, whether you have acne or you don't have acne, because you get some really wonderful, nice little side effects and benefits as well. Let's go to the next slide. Here I am getting it done. So you can, why don't we just play the video real briefly so you can actually see me getting it done. And very
red, and I have a couple little spots of like little hyperpigmentation that we're going to be working on right there. And nothing hurts. Everything feels really fresh. Hi guys, I'm getting my Hydrafacial done, and it feels so great to have it done. I feel like everything is being exfoliated out of my skin. Pores are deep cleaning, resurfacing.
So like I said, it's a resurfacing, wonderful, very easy treatment, no downtime. You come and just feel really relaxed over about a half an hour and you go about your day. So it is really wonderful and soothing. Let's go to the next slide. So if you are one who is actively breaking out, you've got blackheads, you've got whiteheads, you've got acne on your face, you have acne on your back or chest. That's another really big one, is that you can't really reach a lot of stuff back there, but we can reach things for you. So this is a wonderful treatment for acne. I have another condition called KP, or keratosis pilaris, which is kind of like a goosebumpy little bumps like you'll get on the sides of your arms, your back, or like your outer thighs. It's a genetic condition. Some people can actually get it on the face as well. I love it because it just smoothens things out. Again, not cures me, it doesn't cure me, but it does help to smoothen my skin out so that I look like I've got, you know, wonderful, healthy, beautiful, glowing skin. Let's go to the next slide. Yep, there I am getting it done. Okay, wonderful. Yeah, but you kind of get the idea here. So now that we've done our skincare, we've done our homework, because that's 50% of the job is what you do at home. You know, your diet, your lifestyle, being healthy, exercising, managing your stress. And now you're doing the Acne Kit. You're halfway there. Now you come into the office, you're getting Hydrafacials done. Now our procedures will now work that much better. They're going to be deeper. They're going to be more effective. So whenever someone comes to see me, I'm not just recommending one thing, one treatment, one time. I'm doing a combination, collective, collaborative approach, team approach, because we really want to get a handle on those 4 main factors that cause acne. We're targeting each and every single step to get you the best, longest term results possible. So let's go to the next slide. And I believe Crystal might be on. Elaine, is that, if we can have Crystal come on and just say a quick hello. She's our board certified physician assistant. Wonderful what she does. And very experienced and beautiful. I think she's on.
She disconnected. I'll text her again.
Okay, so sorry, we're having some issues with internet activity in the office, but when she's back on, I'll introduce her. So now that we're going deeper, remember we got to the different layers of the skin and we're going much deeper. You're coming into the office, we're getting targeted therapy with your pimples, with your breakouts, with those whiteheads, those blackheads. So now we're really targeting more lesions, as well as, most important, is the scar. Go to the next slide. Next slide, please. Okay, so one of my most popular treatments, if you have fair skin, are still breaking out, and you have redness, if that's you, this is the treatment that you want to have, you want to look up. So write this treatment down. It's called IPL, or Intense Pulse Light. This is wonderful for helping us to treat acne much faster. It helps in because it targets just 2 things, redness and brown spots, So it helps to target the scarring and the pigmentation left, and the uneven skin discoloration that's left over. That's really what this is great at. But in addition, it can help to heal your acne faster. So I really love it for my fair skin patients who are getting to the finish line with their acne, but they just need a little extra oomph. But more importantly, a lot of their acne is healed, but they just have all these red blotchy skin lesions left behind. The IPL works really well. It is not a laser. It is actually a light treatment. So there's no downtime, very safe, very effective. You do have to have a few sessions done for the best results. So I usually tell people to come in once a month for about 3 to 5 sessions. Let's go to the next slide. So here is an example. So you can see redness here with active acne. Of course, doing combination treatment approach with skincare, hydrofacials, and IPL. And you can see that this is going to help heal lesions much quicker and faster. And then we can deal with whatever scarring is left over after the acne is well controlled. Let's go to the next slide. This is another treatment called E-Matrix, specifically for acne scarring. So if you could be any skin type, you could be skin of color. And if you have some divoted scars that are left behind, your acne is controlled, and we just need to deal with scarring. Well, this E-Matrix laser radiofrequency treatment is for you. So you'll want to write this down as your kind of go-to approach. The best candidates are those who just have those divoted scars, those little atrophic divoted scars. They've got more textural issues, and we're trying to smoothen some of that out. So what is it? It's a radio frequency, very safe. So we're using bulk heating to go under the skin to help with heat generation and helping to rebuild lost collagen. Because those scars, that's all they are. It's lost collagen. If we can rebuild some of that lost collagen with time, with a few treatments of E-Matrix, you're going to have much more smoother skin. So again, if this is the main target for you, is helping just the scarring and the acne is under control, which I still would recommend a prevention kit like the Acne Kit. This is a great treatment program for you. This one does have maybe a couple of days that you may want to stay home. It feels like a warm, prickly sensation. We do some topical anesthesia just so you don't have to feel anything. We like to have you nice and relaxed. And it basically works to deliver radiofrequency energy in a pixelated form, just little pixels of delivery of laser of heat energy. And that helps to stimulate some of that lost collagen, helps to smoothen that skin, and you get very natural results. Just like I said, weekend of downtime is what I'd recommend where you're going to have some redness. Let's go to the next.
Crystal just came in, Dr. Sonia.
Okay, wonderful. We'll just have Crystal. She's a board certified physician assistant who works alongside with me, trained by me, and she does all of these wonderful laser treatments. So I'm going to have her come in and just say a quick hello. I know she's busy seeing patients throughout the day. And she might be on in just a minute here. All right, come on in. There she is. Hello.
Hi.
So this is our trusted, beautiful Crystal, and she is going to be the one who will be one of many experts to work with you in a team approached fashion to help with acne and acne scarring. And so E-Matrix is a very, very popular treatment that we do. And Crystal, I believe you have a patient that you did E-Matrix on that is going to be featured on Instagram. Is that right?
Yes. Our patient was kind of struggling with a little bit of everything, trying to fight fine lines and wrinkles, some acne scarring that he had when he was younger. And he is Latino, so the perfect laser that's colorblind is E-Matrix for him. So it's addressing all of his concerns, and he was on his second treatment of it and is already seeing results. So his skin is looking more smooth. He's a little bit tighter. His scarring is a little bit less noticeable than when he first started. So I can't wait to show the video on Instagram. It's good. It got muted, but it's still a great way to see how comfortable he is through the procedure. Very little downtime, so that's something great for our patients too, because he kind of looks like he has a sunburn for a day or two, and then he's still doing whatever he needs to do during the day.
Awesome. Well, thank you, Crystal. We can't wait to see that on Instagram right afterwards. It'll be posted, so you'll actually get to see the full live demo of the E-Matrix treatment, which is a really popular treatment and great for all skin types, which is what I love. Like if you have skin of color, I usually don't recommend lasers, but this is one that we could use very safely in all skin types without any issues. So definitely check that out. All right. Well, thank you so much, Crystal. Really appreciate that. Appreciate the education.
Thank you, guys.
So let's go to the next slide. All right, and this is basically showing that pixelated delivery. So those little circles are areas where the E-matrix actually will go into. So it's not like obliterating your entire skin, but it's pixelated deliveries of energy, of heat energy to really help with collagen building. Next slide. So here's some before and afters of patients who have acne, whether it's hormonal or teenage. The idea is the same. We try to do the 4 Ps approach to pretty skin. Here you can see that there's some active acne that is slowly fading away, but more importantly, it's leaving behind these hyperpigmented spots as well as red spots. And so we're trying to help with getting those resolved much quicker. Let's go to the next slide. And the 4 Ps approach is really what does help to kind of help calm down the skin, help calm down the inflammation, help reduce bacteria, help with the scarring and rebuilding of collagen, which is so important. Let's go down. Next slide. Okay, so we're going to switch gears to the next treatment. Now, if I can get everybody to do this treatment, this is where it's at. Unfortunately, not everyone's a candidate. So listen up. If you have fair skin and you have acne scarring and you are okay with doing some downtime, this is a treatment for you. If I can do more aggressive lasers, I'm going to get you much better results. So this is your gold standard if you have acne scarring, but you must be fair skinned because there is risk in skin of color patients. So what I love about this, your one treatment, maybe another, depending on how severe your acne is. But the idea is we're trying to build that lost collagen even better because we're going deeper. We're going down and dirty and getting really a lot of heat energy to help with rebuilding collagen over time. It's something that you're going to see over the next 6 months. So it's really wonderful for any type of scarring, all of that atrophic scarring from the acne that's left behind. And what's wonderful is you get a wonderful little side effect, which is it also helps with lines and wrinkles. It also helps with some brown spots. It also helps with tightening your skin. It also helps with improving your overall skin tone and texture. It also helps with, which is really important to me, is if you've got a lot of sun damage and are at risk of precancers and skin cancers, it can help to prevent future precancers and skin cancers. And that's really what I love about this. It's like an all-in-one treatment that can do a lot of benefit for all kinds of skin concerns, but very important, fair skin, and there is some downtime. Next slide. And here is what the laser looks like here. It's a large bulky laser, but it does the job. The top left shows you basically kind of the history behind laser resurfacing. Back in the day, the really old generation lasers were too aggressive. They ended up causing way more downtime than anyone could do, like a month or so, and no one could do it. And unfortunately, not very many people really did those treatments. So over time, we now have much more modern technologies that allow for, again, pixelated delivery. So we're still allowing for our normal skin to help with healing the skin much faster. So we're going deeper, but more pixelated delivery of energy to help create some of this heat to recreate this collagen. And it also helps to penetrate into the skin where, which houses all of your sun damage, your brown spots, your lines and wrinkles, your texture abnormalities. So it's targeting all of that. Now, there's 2 types of laser resurfacing treatments. There's a light, which is more superficial, and then there is a deep, which goes more deeper into the skin. Guess which one is going to give you a better result? If you said deep, you are right. I want to go as deep as possible into the skin to regenerate even more of that lost collagen, to help with housing, that helps with housing even more of the sun damage and improving that. So the deeper I can go, the better. However, the deeper you go, the more downtime there is, usually about a couple of weeks. If you're not able to do the 2 weeks, that's okay. You're still going to get wonderful results with the light. And that's 5 to 7 days of downtime. So someone asked me the other day, what does downtime really mean? Well, if it's around Halloween, you will probably be just fine getting away with it. You're going to be sunburned. You're going to probably scare some people away. You're going to feel fine. You're just going to look awful. And I think, you know, I had a person who had it done who was talking to her sister, and she said exactly that. I look like crap, but I feel fine. So you do have to have some of that downtime so that your skin can heal, but you can certainly work from home or whatever you need to do. It's not surgery or where you need to just take it easy, but it's more because of the social downtime. You don't want to have too many people asking so many questions, especially if you want to be private about your procedures. Next slide. So here's a demo. If we can actually enlarge in that bottom one, and let's just show that, no, the bottom one there is perfect. Yeah. Yes. And let's make that bigger. So here's somebody who's getting it done more for the anti-aging, but it gives you an idea of what they're doing there, which is tightening up the skin. And you can actually see it being done immediately. And so we'll have that working just a second here. It tones and it tightens. You'll see actually an immediate effect while we're doing it for you. And you'll see those results actually benefit you over the next 6 months. We do numb up the skin first. You're waiting about an hour, you know, for it to numb, and then we go and do a full face treatment. We could do a couple of passes on, you know, the other areas where you do have acne scarring, but certainly the more passes we do, the more aggressive we are, the better results, but the more downtime that you might have. So just keep that in mind. A very pretty simple treatment. You basically will go home and stay at home. We don't want you to see any sun, no ultraviolet radiation. I want all of the windows and everything to be closed, your blinds to be closed, and just sort of be a hermit for a few days while your skin really helps to regenerate and re-epithelialize and re-heal itself. When it comes back in, your skin is tighter, more toned, more even skin color, better skin quality.
I cannot enlarge it, Dr. Sonia.
Okay, the second one, if we can just, we can delete that one and let's do the second one. It's fine too, whatever works for you. Thank you for.
So basically what we're doing on the upper eyelids, okay? She does not want a blepharoplasty. We're going to do a double pass, and you'll be able to see the skin contraction. Come around that page. Come around that page. Yeah, come around me. So on a scale. So basically what we're doing here is we're doing the upper eyelids, okay? She does not want a blepharoplasty. We're going to do a double pass, and you'll be able to see the skin contraction. Come around that page. Come around that page. Yeah, come around me. So on a scale of 1 to 10, how much pain have you had so far? Dixie, how much pain have you had on a scale of 1 to 10?
Maximum.
Great. For most of the time, about
I
1?
have 2 on the shots.
Okay, great. And how about during the laser?
I don't get that.
Great, excellent. So what we're going to do is we're going to do a double pass here, and you'll see get a close up of the skin shrinkage here of the skin. You'll see 1 pass, 1, 2, 1, 2. You see how the skin is already shrinking, and we're going to go right to the lash line. 1, 2, yep. 1, 2, yep. You're doing a great job of giving me some protection. You can see how quick the laser is. Patient is not jumping at all. Excellent. Okay. And you guys can see we went right to her lash line. I mean, right to the lash. We didn't get it really closer to there. And I wonder one left here.
Patience in a total meditation.
Okay, that gives an idea. This is laser resurfacing for more of the anti-aging properties, which we use really, really commonly, but I just want to give you a glimpse of what you can expect. The patient was feeling very comfortable. She was talking, she was feeling fine, and you can actually see the laser treatment being done as we're doing it. And so when you leave, you kind of have like a white frosted appearance. And then afterwards, you know, you're going to have some healing in that within 24 hours, you're going to get some of the redness, a little bit of peeling. And then over time, your skin will heal. And when it comes back in, it's cleaner, tighter, and smoother. So gives you at least an idea of what to expect. Let's go to the next slide. So here's some examples of laser resurfacing. Again, your gold standard treatment. I recommend it all day to my fair skin patients for a wide variety of different reasons, including acne scarring, which works the best, as well as sun damage, which this is going to be part of kind of an evolving theme this week, is doing laser resurfacing. So if you're a good candidate, this is the way to go. It can help with the pigmentation that's left over, as well as some of the divoted scars, and just helping with the other nice, beautiful side effects, which is helping with sun damage and lines and wrinkles and other anti-aging. And most importantly for me, it helps your skin health. Let's go to the next slide. Okay, so once we've followed our 3 Ps, our 4th P is, now that you've done all the work you want to protect your investment, prevent and maintain. So how do we do that? What do? We're going to go to the next slide, is maintain with the best skincare possible. So the kit that we've designed, I've actually handpicked and formulated exactly what I want for my acne patients, so that it's going to be a treatment, but it's also going to be a prevention. It's also going to be a protection and an investment. The only thing I would do is, this is where I would titrate things and help with individualizing the program even more based on how you're doing. Retinol is one of the ones that we didn't talk about in the beginning, but this is our liquid gold. Literally, this is 100% of dermatologists would agree. Every single person on the planet needs to be on liquid gold, a retinol, a retin-A product. This is what's going to do a lot of preventative work for you over time. So this is where we can tweak formulas and get you higher on concentrated ingredients to really help with your benefit. Because remember, 50% of the work involves you doing your homework at home with the right skincare program. So I wanted to make it less confusing, easy to follow, 5 steps, 5 minutes every day. Consistency is king, and then you will get the results you're after. Let's go to the next slide. So in summary, what are the 4 Ps? We talked about the first P, which is, in this case, our Acne Kit is going to give you the 5 steps, 5 minutes program that you're going to do at home. The second P is doing the peel, which is going to help with extracting and deep pore cleansing, really cleaning out those pores of bacteria and inflammation and oil and debris and all those 4 steps that we talked about in the beginning. You know, whether it's our esthetician doing manual extractions, or it's coming in for a Hydrafacial Md, which is one of my favorites, either one is going to do the job. Third P is the procedure. We're going deeper into the skin now that we've done our priming work and our homework. Now you come and see us, the experts. We are going to be able to deliver better. We're going to be able to give you much faster proven results. So if you're dealing with scarring and your skin of color, I'm going to recommend the E-Matrix treatment for you that I can use on all skin types very safely. If you are fair skin with acne scarring, you know the gold standard. Laser resurfacing is the way to go. If you are fair skin with redness and a little bit of acne still left over, we can do IPL treatments. And final P is to protect your investment. We're going to individualize each program, and we're going to titrate up on our concentrations. And so that way you are really maximizing your home work regimen, so that everything else you do in the office will be maximized. Next slide. Okay, so we're going to get to promotions now for the day. Thank you all for sticking around. For those of you who have any questions, feel free to put it in the chat box. We are also going to be offering more information on Instagram as well, so you get to see some of these videos. We are having complimentary consultations here at the office all week long, so we can individualize the treatment program for you as well. So first P we talked about was the Acne Kit. You can actually use this QR code, scan me, and you can go directly to the site, read about it, and everything that's in here is actually on our website. Today, and this week only, it is 23% off all kits. I have taken so much time to handpick all of these kits to make sure that I am going to be treating 90% of the population of men and women that come to see me. So the Acne Kit was very carefully designed, and it's a program that is easy to follow, simple. So it is definitely different than anything else in terms of over-the-counter stuff and what do I use and when do I use it. And so this is power-packed ingredients that work really well together. So you can get that and purchase it online if you'd like, or you can certainly come into the office and we can also help determine whatever you need in terms of individualizing the regimen even further. Let's go to the next slide. So now we have unveiled our packages. And so the idea here is I wanted to keep the packages very simple for you. So I've handpicked my top 3 packages for acne for people who are like, you know what, I just need to see the esthetician and get started. Great, choose package 1. Or package 2. Actually, one is just with the facials, one is with the Hydrafacial. If you are one that says, I just need help with my redness, great, choose package 3. I wanted to keep it simple and straightforward. However, we do have individualized packages as well if you come into the office for a complimentary consultation. So these are ones that you can purchase online and keep it simple and easy for yourself if you'd like. You would come in for a complimentary consultation to determine candidacy as well. So if we need to switch things, that we could easily do, but this is your top 3 that I would start with. Now, for people who are on board with doing the 4 Ps and they say, just get me started, I've handpicked transformation packages where we do a team approach to really help the acne hand, hold your hand throughout the process. So these are our top 3 packages. The first package includes Hydrafacial, as well as the E-Matrix if you're dealing with both the acne and the acne scarring. For the second one, it is, and all of these, by the way, come with a free kit as well. The package 2 is going to be a Hydrafacial with my favorite, which is the light laser resurfacing. And then package 3 is the Hydrafacial with the deep laser resurfacing. So if you're going to choose one and you want the best results, package 3 is where it's at. If you can't do the downtime, package 2 is where it's at. So these were hand selected by me, just your top 3 to really get you proven quick results faster. And that was really my end goal for you to keep it simple. So you can actually use the QR code now and it will go directly to our website. You're going to notice there is a regimen for each day. You'll go down to the acne section and you'll get more information on each package and which is right for you. You can decide to go ahead and purchase online if you'd like. The theme is really the same. We're celebrating our 13 years and $13,000 in giveaways. So our kits are going to be all 23% off. Our packages are 33% off. Our transformation packages below are 43% off. And then the final one, which is our most exciting, is going to be a 53% off. And I'm going to have Ruby talk to you a little bit more about Club. It's for our VIP members. Let's go to the next slide. So those people who are already loyal to the practice or are already getting Botox and fillers and other fun stuff, I would say just join our Elite Club and you can cash in on more savings and you're going to be able to lock in all of our promotions all year long. Because the number one question I always get asked is, Dr. Sonia, when are your promotions coming out? This way, you're locked in all year round. So Ruby is one of our partners at Elite Club, and she can tell you all about our amazing membership.
Thanks so much, Dr. Sonia. Hi, everyone. My name's Ruby. I'm going to talk with you all briefly about Elite Club. Elite Club is an exclusive membership plan with Elite MD, and we really just offer a financial flexible option for the services that you want to receive. So how it works is you are enrolled in a customized treatment plan with an affordable monthly payment. And really think of it as a monthly investment towards your skin health. And with that monthly payment comes with amazing perks and benefits too. So some of those amazing perks with the plan, additional discounts off of the packages, 53% off packages, as well as you lock in 15% off all of the most popular procedures. Also some free gifts, free Hydrafacial after 6 months. And that's only just some of the benefits. So again, those exclusive specials and priority appointment bookings, you do have to have an appointment appointment schedule to be eligible for the plan. And, you know, this isn't like a credit card or anything like that. You're always paid off. There's no hidden fees, interest, or financing. It again is a monthly investment in your skin health going towards those discounted services that you're enrolled in. You do have access to the Elite Club app too, to be able to track when you're eligible to come back in for those services that you're enrolled in, and you can track that on the app. You can go to the next slide. It just shows a little bit more about what the app shows you. Just walks you through the process a little more. Get the plan, get treated, and then you can track it all on the app there.
Thank you so much, Ruby. It is an amazing plan. It's one that a lot of our patients will ask about, especially because we have so many loyal Elite MD patients, and we thank you for 13 years of being here, of all of your loyalty. So this is a wonderful program for our VIPs and those who are just love treatments and getting treatments and want timely treatments done. Literally, it's like a Netflix subscription. You just do a low monthly payment, you show up for your appointments. So quick and easy. Okay, wonderful. Thank you so much, Ruby. Let's go to the next slide. And if you want more information on acne, here's some of the books that I've actually been a part of, and you can read about the holistic side as well as the medical side. But this is one of my passions, is helping people clear up their skin and have healthy skin for life. So skin of color is my expertise as well. And I continue to do clinical research and do more academic work revolving around this subject. So I encourage you guys to read up. Definitely make sure when you're reading, do not go to Dr. Google for everything, but go to trusted resources is what I ask of you. So next slide. So the fun begins on Instagram. If you are not already following us, make sure that you do follow us, and we are going to be unloading and unlocking some more educational videos. So if you're like, you know what, E-Matrix is kind of cool, I'd love to see a procedure being done. Well, we have a patient that's getting that done, and you can, get an idea of what that treatment is like. So what I would encourage you all to do is, I know there's a lot of information I gave you today. My goal is to give you information so you can make informed decisions for yourself and choose the right plan for you. We are all here in the office standing by for any questions. I would highly encourage you guys to make complimentary consultations all week long with our experts. If you can't come into the office, text us. You can always text us your picture on a HIPAA platform called Clara. It's on our website. And we can also help walk you through what would be best. Or if you're like, you know what, I got this, you can go directly on our website and actually purchase any of those packages, which are laid out to you, which are my kind of picks on helping 80 to 90% of my acne patients. If you're not sure what to get, gift cards are also there, and gift cards are an easy way also to just lock in some savings for you. In addition, everyone that is on here will get a free gift that will be emailed to them. The first 10 people to make appointments today, so our patient support team is standing by, will get a free gift from me that is valued at over $100, which will be some of our wonderful skincare and some of our new launches, which is kind of exciting. So you'll get a little free gift with 2 to 3 different sample sizes of our most popular products. So exciting. I'm excited about that. So definitely give us a call, and I'm happy to answer any questions if anyone has any in the last couple of minutes. And Elaine, I don't know if you saw any questions, but I can certainly stay on for a couple more minutes. I thank everyone for joining me today. I hope this was information that was valuable and you found it helpful, and feel free to give us any feedback on things that we can do better for you, or answer, other top concerns that you might have. But it's so important for me to be on to really give you some honest advice about how best to deal with it, because I see a lot of wrongdoing out there. I see a lot of misinformation, and I see a lot of complications that happen. And once some of this stuff happens, it's very hard to reverse. So I think it's always important to do your homework and to, seek someone in a place that you trust We are a training site. That is one thing to know from us, is that if you come in, we might be doing a lot of trainings and teachings, because that's another one of our passions. So thank you guys for always being open to that, and doing some filming and videoing, which we do a lot of, and that can also sometimes give you a little more extra incentive as well. So I am here to answer any questions for you. Elaine, are there any right now?
I don't see any.
Oh, thank you. Yeah, for those of you who are a little further away, I mean, we get people from all over the world. We're so fortunate, but we get a lot of local people as well as people that live far away. And that's why I wanted to bring it so that's easy for you. So everything is available online for you, and we are available through texting or through calling us. We'll help walk you through anything that you need. We're here all week long. Oh, and Saturday, we are open this Saturday, which is rare. We're not always open. So yes, Lane, if you are available on Saturday, you can always give us a call to come in, and we can also help you through. But we so appreciate you guys listening in. And I know that some people do live far away. So thank you so much for your time today. Okay. All right. Well, I appreciate this. I will see you guys then on Instagram. If I get a chance, I will probably do some frequently asked questions there as well for our Instagram community. So definitely follow us and listen in. And then all week long between 12, we'll do a lunch and learn, 12 to 12:30. I know we went over today, but we're going to be giving you information on your top 5 concerns that I do see in the office. Tomorrow, join us for body sculpting. So anything related to stubborn body fat, I will have the answers for you. So definitely tune in tomorrow at lunch, followed by hair thinning on Wednesday. Thursday is anti-aging. And then Friday is sun damage. So we'll see you guys very, very soon. Thank you guys for joining us.